Hey guys, welcome to our episode for this week. This is episode 4. We're very excited to have you with us again. So we're going to start this week by going off any questions from the last episode, and then we'll give you a little bit of an update on what we've been up to, and then we're going to go into this week's topic, which has to do with before and after photos. So a little bit of a discussion-based podcast this week.
Yeah, it's actually a very exciting topic. It's something that's very prevalent to all of us, not only as injectors, but I think as consumers as well. It's very important. So first, let's talk a little bit about last week's episode. A few questions we had were regarding platysmal bands and how to treat those and how they overlap with the chin area. Treating the neck or the platysmal bands, there's different ways to do it, there's different methods, and so we want to talk about it all in one episode.
So that will be coming soon. Stay tuned. So a little bit of an update on what we've been up to the last few weeks since our previous podcast. Michele and I attempted to attend a conference in Calgary for a new skin booster called Skin Vive by Allergan. We will be covering this topic in general of skin boosters next week, so we'll get more into that then. But we did want to let you know that we were virtually attending this conference, and we did learn new techniques for injections, in particular for this skin booster, from a dermatologist from Switzerland. So very exciting for us. We always try to stay up to date and current with all new products, injection techniques, different ways different physicians and nurse practitioners inject. We can always learn and stay updated to give you guys the best results.
All right, so this week we are going to cover social media, pictures, before and afters, and how lighting or different things might impact our before and after photos. And this is a topic I think that, oh gosh, there's so much to cover here. And I think as an injector, it is one of the hardest things to do is get really accurate before and after photos.
There's so many things that can impact these before and afters, like Michele said. I think the biggest take home is that we try and keep them as accurate and similar to the before and the after in terms of lighting, angles, distance from the camera, to show the most accurate depiction of the results for ourselves, our work, but also for you when you're looking to find an injector. A lot of people search for before and afters online, and we want you to come in with realistic expectations. And some of the time, these before and afters actually promote the opposite. People come in thinking that they're going to have life-changing results, which sometimes happen, but also this is not surgical procedures we're doing here. They are injectable treatments, and we have to have realistic expectations. That's really important for us as injectors, but also for you as patients. And I think a lot of the time, these unrealistic expectations come from what people are seeing on social media.
Yeah, even if you think about social media with filters and everything on like Instagram, people are posting videos, and editing is becoming so good and almost like undetectable. And I think that it sets, like, people think, oh my gosh, this is so achievable. There's flawless skin out there with essentially no pores, and it just doesn't exist. And the same thing happens with before and afters in the industry, honestly, and we are by no means have perfected this art. We are so far away from it. We are definitely striving to be as honest and to show as much, like the realistic result as possible. But it's hard. It really is tough. And I know that injectors that are listening, you guys know this, that the struggle is real with this. But I still think we still need to strive for the best before and after we can give. So we're going to go over a few videos and a few pictures of how different light can distort the before and after, how different angles and different positioning of either you or your client, and then also the different distances of the lens. You can get lens distortion. So we're going to go over a few videos and side by side, and then we can chat a little bit about it.
All of these side-by-side photos were taken the same day without any injectable treatment. This photo shows a change in the angle of the patient's face, which makes her appear slimmer. This set of photos highlights lens distortion, and you can see in the second photo, it really accentuates her cheeks, nose, and chin. These photos show a change in the angle of the patient and the angle of the camera, giving the second photo a more lifted appearance. These photos highlight lighting changes between the before and after, and you can see the difference in the nasolabial fold and under eye area. So now that we've kind of gone over ways that we've seen some distorted images from before and afters online, we wanted to give you a few tips that we've learned along the way. Again, by no means are we perfect at doing this. One of the things that I learned early on, which again, we're not great at doing every time people come in, but a lot of the times it is recommended to have an actual photo area in your clinic or in your injector room, wherever it may be, with markings on the floor, okay? And then getting the patient to stand on those markings, having a marking on the floor where you stand, and then changing the angles of the patient, not where you're taking the photo from. These can create more realistic and more comparable before and afters. Lighting is huge, so if you have a big window in your exam rooms like we do, sometimes if you take your before picture and then half an hour later you're taking your after picture, the lighting can change. So having a blind or something closed that you can keep the lighting very similar is another big one.
Yeah, definitely. And I think backdrop is really important, and that's why if you have a certain space where you're always doing it, then you can have a similar backdrop. But if you don't have that in your clinic, then just going to a same wall or having a similar background is helpful. Another big thing is not only having a marking on the wall where your patient needs to look, but because of different height differences and because I can still look at the camera and shift my head in different ways, it's really important to try to get your patient, there's a little line, so it's from your nose to kind of your inner ear, to try to get that line as flat as possible. So your head is in the same position is also very valuable.
Right. And I think another big thing is taking photos from all angles. So we usually do head on, 45, and then 90 degree, both ways, so that you can get representative pictures from all angles. Another great way to do that is with an actual video before and after. So you can take a 360 video of the face and then one after, so you can really see the full face transformation.
Yeah. A big thing I also see is expression. So in your afters, and your patients are super happy. They just saw in themselves in the mirror. Some of them are a little bit teary-eyed because they're really happy with the results. They can be smiling in their after photos, whereas before, their makeup's off, they're not feeling that great, and you're taking a photo of them, they can be a little bit sheepish and shy. So looking at your before photos right before you take your afters is important as well, because you want to have a consistent expression. And that being said, then also trying to get your patient to kind of just have a resting face in both before and after is important, will give you better results.
Yeah, which is very difficult to do. All of these things we're saying are very difficult to do, especially when you're in your clinic. It's a busy day. Sometimes it's even hard to remember to take before and after photos.
Yes.
But it is great for your practice. It's great for your patients to see these before and afters. And most of these treatments, filler especially, does not come without risk. It is something we go over with you prior to injecting, but there are potential complications. Most of these things can be recognized in the clinic immediately. However, sometimes we do send people home and they have issues after. So it is important to see the progression of this. And if we have something on hand that was taken immediately after the treatment, then we're able to compare it. How soon is it progressing? Are we concerned about this? Is this an issue? And it helps us kind of base treatment moving forward.
Yeah, even simple things like facial discoloration. A lot of people have different either pigmentation, or you can have, a bit of redness in a certain area or patch prior to treatment, and that if that just showed up right after treatment, there might be something potentially suspicious about it. So being able to see, oh yes, it was there prior to as well, just kind of gives you, a peace of mind as an injector or also as a client.
Exactly. Yeah.
There's also software available out there. I don't really know any names offhand. I know that we are getting something new for our clinic here to try to standardize our photos. So everybody that comes in will stop in and get standardized photos done in this little photo booth, and then come into our rooms. And so there are things that are available. Definitely do some research, and I'm sure as technology advances that those are only going to become, better and more available.
Exactly. Yeah. So I think the biggest take-home message from today is before and afters are very important for multiple reasons for both the injector and the patient. And we want to try to keep those as close as possible in terms of all these things we've discussed today. Awesome. Well, that kind of brings this discussion-based podcast to an end today. Again, just a shorter topic. If you have any questions, comments, please reach out. If you have any suggestions for future episodes, we would love to hear from you. Thanks so much for tuning in, and we will see you soon.